Sure.
All right, cool.
All right.
All
Tell the
right,
world
so
about fascia. I'm gonna be right back.
all right, weird. Okay, so the reason why you would even kind of like go about getting cupping in the first place. And hello guys, how you doing? What are you up to? Are you on the cardio machine right now? Are you driving? You just moseying down the road? You enjoying this long walk on the beach? What you up to? All right. So on the cupping. So what is the objective of cupping and scraping and stim and all of these things? Basically, in my opinion, and there's obviously a shit ton of opinions out there. Just take mine with a grain of salt, just like you should everyone else's. Fascia, right? So fascia is like this loose connective tissue, and it innervates absolutely everything. If you put your hand like on your arm and you put your hand on your skin, like on your forearm, and then move it around, you can kind of pull up and down and side to side. Your skin gives in different directions. Basically, the bottom of your skin has fascia connected to it, and that fascia is connected to or innervates, the rest of your body and those muscles and things like that. So when you pull your skin and then you let go, it snaps back into place, and that's because that fascia has pulled that stuff back into place. Basically, what can happen with that fascia, that loose connective tissue, it's like a really complex web. And if it gets dehydrated or if it's stagnant and doesn't move, it can get bound up, and it can cause restrictions in range of motion anywhere. It can really happen anywhere. So basically the idea with cupping and scraping and just massage therapy in general is to manipulate that fascia, manipulate that tissue, make it a little bit more plastic so that it brings a little bit more mobility to the tissue and to that joint or to whatever joint you're working with. So quite literally with cupping, it applies pressure onto the top of the skin and it literally pulls the tissue up into that cup. And that tissue is innervated by fascia. So it will pull on that fascia as well, hopefully kind of releasing whatever tight areas that you have. Same thing with scraping and just massage therapy in general. All of that stuff is kind of manipulating that fascia in hopes to release the bound up areas in that tissue. And that is good timing. That's pretty much that. I feel like I nailed that. I want to clip that.
I'll clip it for you.
Thank you.
Yeah.
Yeah.
Sick, man.
What was that?
That was that. Quick question about fascia for you, actually.
Cool.
Why would you use one mode over another? Like, why would you scrape first cup?
Yeah. So like I had said, like they're all just different modalities. And from what I'm understanding, so the fascia obviously innervates the tissue pretty deep, and fascia also kind of like segments the muscle bundles as well. So it separates the like muscle tissue as well. Like your IT band actually like folds over or under the lateralis to separate your quad from your hamstring. Like it literally is like these separate compartments of fascia, right? If you could imagine those compartments of muscle and then fascia innervating those muscle bundles and then those little like individual fibers. Like the fascia goes super deep. It's a huge web. It's super complex. So you can have fascia that's superficial and you can have fascia that's fairly deep. And as I was explaining before, you can have that, like if you put your hand on your skin and then you pull it up and then it kind of like snaps back down, that is the superficial fascia kind of pulling that skin back. But that fascia, mind you, is also innervated fairly deep. It's connected to tissue that's really deep as well. So when you do scraping and things like that, that's going to be primarily for superficial fascia, the fascia that's on the top, or something that's a little bit more surface level, that you can kind of manipulate. So people who have suffered like from like scar tissue damage and like things like that, and that fascia or that connective tissue is like bound up and scarred superficially, grafting is pretty nice at getting to that stuff. And then with the cupping, which is kind of interesting, is when you put the cup on, it will suction cup onto that muscle, so on that portion of the muscle, and it pulls the muscle up into the cup. And again, just like you would kind of be like manipulating your fascia if you were to pull up on your arm, it pulls the fascia that's like a little bit deeper in that tissue. And then if you could imagine applying like stim to that as well, now you are having that tissue move in that pulled section. So it's kind of like pulling the fascia in different directions.
I've heard that to really get, any usefulness out of cupping, you have to take the muscle through its range of motion.
Yeah, and kind of move it.
I've seen a bit more recently people actually doing cupping while exercising.
Yeah, I could totally see that.
Yeah.
So that's and stim does a fairly similar thing, I guess, because it just tells the tissue to fire.
Right.
Yeah, and if you think about it, all of those individual bundles are innervated by fascia. So when one thing fires, it's pulling that fascia with it. And if it was bound up or connected to something that was bound up and it gets pulled and then it gets unbound, now you have some unbound tissue and more access and range of motion at that joint.
Right.
And I was like, kind of what I was telling everyone before was like, that's kind of the overall goal with all this stuff, is just kind of to release those bound up areas of fascia that are really connected. And yeah, it's pretty cool stuff. That's why I thought it was like so interesting, and I've run into a couple clients that had frozen shoulders, and frozen shoulders are actually a little bit different. That's a little bit more of a neuromuscular thing that's going on there. From what I've understood, I don't really know too much about them. But something weird. Have you ever had someone with a frozen shoulder by any chance, or like had a friend with a frozen shoulder?
I haven't, but I know about them, and I don't really know what they are.
Yeah. So they're like something that develops like over the course of, I guess, like 4 years. It's really weird. It's one of those like weird ones, but bottom line, your scap gets like locked to your upper arm. And like when you want to like move your upper arm, your scap pretty much moves with it, like degree for degree. It's pretty much like locked in place. And but this weird thing, I don't really know if it's exactly true because I haven't seen it. It's kind of hard for me to like look a video up of this in particular. But apparently, if you were to knock someone out with a frozen shoulder, their frozen shoulder isn't frozen anymore after they get put under anesthesia, which is interesting. That's a neuromuscular thing. Like much like cramping is also neuromuscular. Like if you were to point your toes and curl your toes really hard, I can almost guarantee your midfoot would probably cramp up because that tissue isn't used to being in that fully shortened position. And that can happen like everywhere, frozen shoulders included. Yeah, it's weird. It's weird, dude.